my goal at the during the conference was to deliver a talk about an update on the pharmacological management of Alzheimer's disease. So my talk was divided mainly in two parts. The first one was the current management in most of the countries up to this moment, maybe except to the US, which already has the new anti-amyloid medications, at least two of them. But in most of the rest of the world, we still do not have these drugs approved. So in the first part, I talked about cholinesterase inhibitors and Memantine, which are still used, which are used in all countries, I believe, or in most of the countries, including the United States. These drugs have proven to be efficacious in terms of improvement of clinical symptoms based on the pivotal studies, the randomized clinical trials that have been conducted several years ago. These drugs can be used in the dementia stage of the disease, from mild until the advanced or severe dementia stages. These drugs are well known in terms of their pharmacological characteristics and their side effects profiles, safety profiles, and so on. And so I presented briefly about the efficacy data in terms of short terms, especially 6 months. And also I presented some data on meta-analysis, which have proven that these drugs are, although have modest effects, they are helpful in terms of improving symptoms of patients and also with benefits to caregivers, to family caregivers, or to caregivers in general. And I also presented data from a more recent Swedish study published 2 years ago, which is an interesting study that captured the real life or naturalistic study, the real life effects over the course of several years. They have evaluated the cholinesterase inhibitors in a large group of patients, compared with a large group of patients who did not receive these drugs over the course of several years. And they investigated two specific outcomes, which is reaching the stage of severe dementia and mortality. And in this study, they have proven that these drugs have positive effects on these two outcomes. So I think this is an important message, that maybe the study, although it was published in Neurology, a very good journal, it's not known by the overall audience. So it's interesting in terms that this drug, although you may not see in the clinic the symptomatic effects clearly, according to your evaluation or to the patient or caregiver report, they can offer this long-term benefits as well. So this was the first part of my talk. And in the second part, I talked about the new results of the anti-amyloid clinical trials, mostly aducanumab, lecanemab, and donanemab, showing their results in the phase 3 clinical trials, which were positive. In aducanumab, one study positive, the other negative, but for lecanemab and donanemab, results were positive in comparison to placebo. These drugs were evaluated in people with mild cognitive impairment or mild dementia due to Alzheimer's disease. These studies lasted 18 months, 1.5 years, and they were superior to placebo in terms of providing a slowing in the cognitive and functional decline, albeit not leading to symptomatic benefits. So it's just that it's slowing down. I also alluded to the fact that these drugs have important safety concerns in terms of especially ARIA or amyloid-related imaging abnormalities, edema or hemorrhage, which may arise in a considerable amount or percentage of individuals, particularly those who have one or two copies of the ApoE4 allele. And besides that, I also mentioned that these trials have some caveats in terms of the representativeness of different ethnicities. So the vast majority of participants are Caucasian or white people. So we have a low representation of people from African American or even Asian background, mostly African American. So and also Latinos. So this is important in terms of knowing the effects and knowing the safety as well among these other populations.